Well, it could be a devastating 1-2 punch. Top brass at some Connecticut hospitals say the governor's proposed spending plan could be a knockout. Good afternoon, everybody. I'm Keith Kuntz. It's sick. At least that's what some Connecticut hospital officials feel about Governor Malloy's proposed budget. Hospitals could be losing some big money, which could have an impact on everything from the emergency room to the operating room. The details now from News 8's Aaron Cox.
Hospitals in Connecticut sounding the alarm, claiming care could be in crisis if planned cuts go through.
Certainly, I think the governor's off the wall trying to cut the hospitals by the $550 million. I think it's just crazy.
Republican lawmakers joining with doctors and the presidents of both Bridgeport and St. Vincent hospitals, the group holding a press conference today to voice their protests. They claim the proposed two-year state budget cuts $550 million to hospitals across our state. Bridgeport Hospital says it would be out some $22 million, leaving it no option but to cut staff, including those giving bedside care.
If the budget is passed as proposed, it's a certainty that jobs will be lost. Have no idea at which category yet.
However, a spokesman for Governor Malloy says funding is basically staying flat, not being cut, adding over the last decade, state funding for hospitals has increased over 200%. But these medical professionals have a different diagnosis, predicting a dire outcome.
They will result in the elimination of services necessary to care for people along the continuum. Innovation needed to move forward with healthcare reform will stop as we go into survival mode.
Hospital executives say they are willing to talk with the governor to try and come up with some kind of compromise before the budget is voted on in just a few weeks. Reporting for News 8, I'm Aaron Cox.